Serious. Doctors of Reddit, what is the most stupid thing a patient has said trying to correct you? I asked a patient complaining of dizziness if she had ever been diagnosed with vertigo. The daughter chimed in and said, No, she's a Libra. I then laughed hysterically at her awesome joke. She was dead serious.
Did that end up turning into a complaint because they felt they weren't taken seriously? I'd honestly feel like the guy dealing with the complaint would laugh too. Lol.
Patient comes in with abdominal pain. I think it's my gallbladder, they say. Looking over their chart, I see their gallbladder was removed 20 years ago, so that is impossible. I mention this, to which they reply, yeah, but it grew back. Edit, yes, I know there are a number of other things it could have been. A retained stone crossed my mind, but after 20 plus years I found this unlikely. She also had the scar to vouch for the surgery. There was definitely a psychosocial element to this case.
You know, I had mine removed 7 years ago, and this past January, I couldn't sleep because I felt like I was having a gallbladder attack. I went into the ER and told them I know I don't have one, but I swear this is what it feels like. Turns out, I had a massive stomach infection. It honestly felt the same.
I took care of a child that got chickenpox. The mother was strongly anti-vax, but was yelling at me, how can modern medicine not have a treatment for chickenpox? She couldn't grasp the concept that we do. She just refused it for her child.
I want to cunt punt these people so bad. We're on the verge of total eradication of some serious illnesses, not to mention the advantages of herd immunity to immunocompromised people. Even second and third world countries are seeing huge reductions in outbreaks, but no. Thanks to these guys, the richest parts of Southern California and parts of Europe are still dealing with outbreaks of diseases we've beaten.
Me, sir? I need to know why you stopped taking your antiretrovirals for your HIV. Him? Well, I met this witch online that. Me? Wait, did you just said witch? Him? Yeah, she sent me a bunch of herbs every month to cure my HIV. And they worked. Last time I checked, I was cured. Me, where and what test did you do to know you were cured? Him, I made an online test that the witch told me to. They were a lot of random questions, but in the end, it said that I was free of HIV. Me, look, we'll need to do a blood test to confirm that. Now, can you tell me which herbs were you consuming? Him, I don't know the name, but I have them right here, points at his backpack. Me, may I take a look? Him, sure. I opened the bag and what I saw was nothing but grinded oregano with something that smelled like chlorine. The patient, sadly, died from a severe sepsis a month later with a highly resistant microorganism. Just because a witch in a website told him to stop taking his meds.
Why did he go to a witch for healing? That's the cleric's job.
A mother brought her 14-year-old daughter to the ER due to hypogastric pain and spotting. We asked the daughter when was her last period. She said it 2 months ago. We asked her for her sexual history, thinking this might be an ectopic pregnancy. The mother kept butting in saying that she is still a virgin and she has no boyfriend. We left it at that until her mother went out to go to the bathroom. The patient admitted that she had sexual intercourse with a classmate of hers. We requested for pregnancy test and HG titers. It really looks like ectopic pregnancy. We advised the mother that her daughter needs immediate surgical intervention. She refused to believe us, saying that the lab results are unreliable and untrue. She keeps on saying that her daughter is a virgin. She stormed out of the ER with her daughter that looks really in pain. I had a patient once with family members who were some of the most frustrating people I've ever dealt with. The patient was morbidly obese and had open sores and wounds in all her skin folds. Cleaning her when she was first admitted was like some sort of disgusting clown car. We found a floral pillowcase shoved under one fold and what we think was a smashed bread crust in a fold near her groin. Anyway, because of her weight, she wasn't a candidate for surgery, and therefore there was nothing our team could do for her. I think about 5 or 6 different meetings were held with her family to discuss her prognosis. Her daughter told the attending physician he didn't know what he was talking about, and that she had been this sick before and pulled through. Her pay was so low it just read as less than 6.8. and her blood pressure was a solid 60/25, despite every vasopressor under the sun running at 3 times the max doses. When the charge nurse pointed out her blood pressure on the monitor, the daughter said, "Pesh, I've seen lower." When she finally died, her family was livid that we didn't save her. We coded her for 20 minutes and they told us we should have continued for at least an hour. I felt terrible that her last days were spent in such torture, all because her family was in such denial about her condition. 1-year-old hospitalized with ingestion of unknown drug. No immediate signs or symptoms. Mother says it is heroin from her brother's stash. Urine comes back positive for meth. Mom gets very angry and defensive and tells us it is just heroin, and we should stop accusing her of having meth. Like, lady, why you think letting your toddler try heroin is so much nobler? Edit. Another one I remembered back from my GP days out in the middle of nowhere. Lady comes in with itching of the scalp. I look at her head and she has matted, greasy, extremely dirty hair that actually smelled. I have seen a lot of dirty people, but it was really something else. She wanted medication. I suggested she wash and comb her hair regularly for a few days and see if it would get better. She said, "And what if I wash my hair and it doesn't get better?" Well, I am sure you can accumulate the filth again in 10 years or something, so it is not a permanent loss.
I work in community mental health and see a lot of people on a wide variety of illicit substances. It always cracks me up at the number of heroin addicts that are horrified by the idea of using meth and meth addicts that are offended that we would think that they would use heroin.
Lady comes in with shortness of breath. We check her troponin levels. They're elevated. "Ma'am, you're having a heart attack." "No, I'm not." Yes, you are." "No, I'm not." Her PCP came into the ER and fired her as his patient. She signed in against medical advice and left. She died the next day. Of a fucking heart attack. Yeah. I introduced myself to a patient as doctor. "You're an anesthetist." Patient said that I could not be a doctor as anesthetists aren't doctors. Not long after, another patient asked me if I had to go to uni to be an anesthetist, and still another asked me if I had to know as much as a pharmacist. Edit. The number of patients I have seen who are acutely unwell because they stopped their medication does my head in. Almost always the reason they stopped the medication is because the condition they were taking it for went away. As a result of the medication, SMH. Ophthalmologist here. Told patient he needed reading glasses, which he didn't believe. I explained that everyone develops presbyopia eventually. "Come on, George Clooney doesn't wear reading glasses." Yes he does in B. Not sure why you were comparing yourself with him."
Oh no. 25 years ago, I had hell of a time as a kid because I have myopia at age 7. Family didn't allow me to wear glasses unless I'm outside Co's. They believed the eyes would readjust to normal and the myopia would decrease. I ended up perpetually squinting. No, my myopia never went down. I have very high diopter myopia in adulthood now.
I thought this was just me. Parents said blurred vision was just a phase that I could beat if I wanted to. I still feel like I failed somehow by not training my eyes hard enough. Sorry you went through this too. Had a female patient. Her mom asked me to adjust her scrotum. Trying not to burst out laughing, I said, "Your daughter's scrotum?" She acted like I was stupid and pointed to the back of her neck. I knew she wouldn't listen as she was so convinced, so I stopped arguing with her. And I also wanted her to go around saying it to other people.
Gotta make your own entertainment.
Had a female friend tell me one day her balls were aching. I stared at her for a second and asked what she said. She said her balls were dry and achy. I stared again and asked what she meant. She meant her eyeballs. She calls her eyeballs balls and she was confused on what else they could mean. We call her Jesus Jen for a reason. The time I was telling the family that the patient is going to die and her lab results, Peach 6.6, lactic acid 25, are not compatible with life, and they said they were pretty sure she would wake up if I put ice in her underpants. Well, yeah, we are not going to do that. She died, and they still didn't believe me she was dead. They kept trying to wake her up. 20-year-old girl and her fiancé find out that she's pregnant.me. Partway through taking her history. Do you smoke cigarettes? Yay, about a pack a day.me. You should definitely stop that. Her? Well, my sister told me that if I stopped smoking, the baby would go into withdrawal and die.me what? PSA, don't smoke if you're pregnant or planning on becoming pregnant. It's never too late to quit. Had a patient come into the ED for what was essentially a cold. Kept requesting antibiotics, kept explaining that they wouldn't help her viral symptoms. But I did then sit down and give her a basic tutorial on the differences between bacteria and viruses, and antibiotics and antivirals. Hopefully it was enough to help her in medical school finals the next week. Edit, thank you for all the upvotes. I have surpassed my husband on his upvotes. I'm a doctor, but this was my nana, not a patient. She was drinking 11 cups of coffee a day, which is too much. We held an intervention while visiting for dinner, and when we told her she was addicted, she responded, No, the coffee is good for me. It helps me with my shaking. She cut down once we explained to her what drug withdrawal was.
The fact that you got a little old Italian lady to change her mind and do what you told her to do is amazing.
I must say that almost makes the story too unbelievable. Mom of baby, I don't vaccinate. It's against my religion. Me? Oh, really? Just out of curiosity, what religion is that? Mom, I'm Catholic. Not really a correction per se, but made me laugh a lot.
My mom didn't vaccinate me, and she claimed religious exemption every year because my schools required it. Her religion is like spiritual.
Why are you looking at my hip? I said the pain was in my knee.
I don't get people like this. I go to the doctor, tell them what I'm feeling, and then let them do whatever the fuck they need to do. My knee hurts. You want to stick something in my ass? Go ahead.
That's the spirit? Doctor here. One we get commonly is I know my body. Scoped a guy with knee pain, the joint looked perfect. Told him after the surgery, and he told us no. My tendons are all torn. I know my body. Told a lady she was pregnant. No, I'm not. I just had a big lunch. I know my body. Edit, absolutely. When something doesn't feel right and your doctor doesn't want to listen, seek a second opinion. You know how your body normally feels. But if someone has performed an invasive surgery to look at your joint, or has seen a fetus on ultrasound, they probably know what they're talking about.
My body is just a casual acquaintance.
Probably the legions of women that seemingly don't know how long it can take for an IUD to work and want it taken out because it didn't instantly stop their periods within a month. Also the women that come in with chlamydia but deny having had sex. Like, come on. I'm not your boyfriend, you don't need to lie to me. Me, your blood pressure is very, very high. You need to take the blood pressure medications I prescribed you. Him, I don't need no pills, doc. All I need is Jesus.
Well, to be fair, without pills, he'll get to see Jesus very soon.
Radiographer here and had the ED doctor give me a request for soft tissue neck x-rays, and the doctor was much like don't question it. Just do it. Anyway, after that patient had left the ED, doctor came and told me that the gentleman presented to AD at 3 a.m. because he had hot milk 3 days ago, and his tongue has been hurting ever since. The patient basically burnt his tongue but was insisting on a x-ray to ensure nothing is wrong. Everyone with something stuck in the bum somehow just innocently fell on it.
I periodically send this to my brother to remind him that things could always be worse. No matter how bad it gets for you, just remember someone, somewhere in the world will have to go to the emergency room this weekend to have something removed from their ass.
It's really sad when it happens, but when I have to explain to people that their limbs aren't growing back. Thank you for watching. Don't forget, subscribe this channel and watch out next videos. Bye!